Hello, everyone. Welcome to our FASD Champions Connect. Today, our guest speaker is Lynn Cole. She is a pediatrics nurse practitioner, and she also has her doctorates in as a nurse practitioner as well. Today, our presentation is brought to you by the DNP's midwives and nurses partnering to prevent FASDs, and we are a member of the Collaborative for Alcohol-Free Pregnancy. Before we get started, we want to do a land acknowledgement. So we gather today on the ancestral and traditional lands of the Dena'ina Athabascan people. So for thousands of years, the Dena'ina have been and continue to be the stewards of this land. It is with gratefulness and respect that we recognize the contributions, innovations, and contemporary perspectives of the Upper Cook Inlet Dena'ina. We acknowledge that the University of Alaska Anchorage and other institutions were founded in the aftermath of influence that led to exclusions and erasures of many Indigenous peoples, including those on whose lands we live and work. This acknowledgement is one step in the continuing process of continuing to dismantle the ongoing legacies of settler colonialism, including the racial, cultural, and political accusations and judgments of risk and blame associated with alcohol use and the role it plays in shaping and reinforcing stigma and stereotypes in our communities. We also have a disclaimer. This project is supported by the U.S. Department of Health and Human Services Center for Disease Control and Prevention, and the cooperative agreement number is NU84DD00006. And these contents are solely the responsibility of the authors and do not necessarily represent the official views of the CDC, the U.S. Department of Health and Human Services, or University of Alaska Anchorage Institute of Social and Economic Research. Okay. So with that said, I would like to introduce our speaker for today. Our speaker is Dr. Lynn Cole. And Dr. Lynn Cole is a pediatric nurse practitioner who specializes in the care of children with complex developmental and behavioral challenges. She has particular expertise in adoption and foster care, fetal alcohol spectrum disorders, autism, intellectual disability, cerebral palsy, and the health and behavioral challenges these children experience. Dr. Cole works at the University of Rochester as the Director of Clinical Services in the Division of Development and Behavioral Pediatrics, and she is also the co-director of the FASD Diagnostic and Evaluation Clinic. The FASD Diagnostic Evaluation Clinic is a multidisciplinary clinic that serves children and adolescents from infancy through 18 years old. And the services they provide include FASD diagnostic evaluations and neuropsychological assessments to identify the child or adolescent strengths and weaknesses to aid their treatment planning. Dr. Cole also teaches undergraduate and graduate nursing students and other developmental disorders. So thank you, Dr. Cole, for joining us today.
Absolutely, I'm happy to be here.
Yes, okay. Well, so as you know, I have some questions for you, and it is mostly centered around March because March is Brain Awareness Month. So my first question is, what impact does prenatal alcohol exposure have on brain development?
So we know that prenatal alcohol exposure really affects all systems of the body, and that drinking at any point during pregnancy can cause damage to the central nervous system. But the extent of the structural damage is really affected by the timing, so the period of development when the exposure occurs, and likely the level of exposure. Overall, alcohol exposure slows down the reproduction of neural stem cells, which drive the development of the fetal brain. And when those neural stem cells are still able to reproduce, the alcohol interferes with their migration to the right area of the brain, which further develops or disrupts brain development. We know that alcohol really affects the brain overall in terms of people with FASD when they're in large groups of people with FASD are compared to people without prenatal alcohol exposure. The overall brain volume is somewhat smaller with a reduction both in the gray matter and with some disorganization of the central nervous system. That being said, we know there's particular areas of the brain that are real extra sensitive to the effects of alcohol. Those include areas like the parietal and frontal lobe, the cerebellum, the corpus callosum, the caudate, the basal ganglia. And as we talk later a little bit more about the areas of learning and behavioral impact, some of those line up to the areas of the brain that are impacted.
Right, yeah. And so that was actually going to be my next question is how might these, impacts manifest in like cognitive, emotion, and behavior?
That's a great question. Yeah. So what we know is that there's really a lot of factors that play into that. And there's a lot of variability in how people with FASD are impacted. One big component is the pattern of alcohol exposure and the developmental timing of the alcohol exposure that can really contribute to a wide range of outcomes. There's likely other factors, though, that may include things like genetics, epigenetics, things like other exposures, such as exposure like to marijuana. But what we know is that in the areas that alcohol can affect a wide range of cognitive, emotional, and developmental areas. In terms of cognition, we know that prenatal alcohol exposure is the leading preventable cause of intellectual disability, so of having low cognitive and adaptive abilities. And so some proportion of children with FASD have cognitive abilities in the range of intellectual disability. That being said, the vast majority of people with FASD have cognitive abilities that are in the solidly average range. They may be somewhat, if you look at people with FASD compared to people without, their scores may be somewhat on the lower end of average, but most people have average cognitive skills. And that's one of the reasons that this can be a real hidden disability, because the type of testing that children might get, like through their school system, might show that they have solidly average cognitive abilities, yet their daily functioning can be really impaired. And so it often makes people misunderstand them by thinking that it's just that they're not trying, or that a child might be trying to be difficult. When what we know is that there's these more hidden areas that are impacted. So things like learning and memory. Children with FASD might have particular challenges with visual spatial skills, or the learning of complex concepts such as in math. Math disability is a particular area of challenge for many kids. Certain areas of memory, particularly auditory memory, can be really impacted. And then the area of executive functioning. So this is those higher order cognitive processes that require like complex thought and memory and behaviors, so that you plan and organize and sequence things in order to accomplish a goal. And these areas are pretty universally impacted in people with an FASD, and can really have make daily life very, very difficult in ways that are hard for other people to understand. The final area that's really impacted, and this is a bit of a component of executive function, but is controlling impulses and regulating emotions. And then again, this is an area that most people with FASD have a lot of difficulty with, is managing intense emotions, managing and inhibiting impulses. And this can be really be misperceived as being purposeful, or some other attribute of the person, as opposed to related to their disability.
Right. Okay. So it sounds like they're having to cope with a lot of challenges because of alcohol exposure, right? Yeah. So in that sense, right? So how might, like, what is the role of nurses and midwives in kind of the diagnosis and the treatment of FASDs?
This is what I love talking about, because I think nurses and midwives could have such an important impact on the care of people with FASD, really because nurses are in all of those locations where people who have FASD or people maybe who are at risk for having an alcohol-exposed pregnancy are seen. You know, nurses and midwives are in schools, they're in primary care offices, they're in hospitals and mental health settings, in justice settings or in community health promotion settings. And I really think that if, as a profession, nurses and midwives had awareness about FASD, knowledge about what can be done and why diagnosis and treatment is important, if they knew how to work with people who might be at risk for an FASD or a prenatal exposure during pregnancy, they might be able to help with prevention efforts. Nurses are also really good at recognizing strengths, and people with FASD spend a lot of their lives hearing about the things they're not good at. And I think nurses could be really powerful in helping people recognize and accentuate their strengths, so that they could have an accurate diagnosis. You know, nurses could help with the chronic management and also with some of the advocacy work that's so needed.
Right. Yeah. So they're kind of really a key players in kind of like a more strengths-based approach
Absolutely.
to treatment of FASDs, which is really great.
Yeah.
You mentioned kind of briefly about prevention. So I'm kind of curious too, like, what do you think is the role of nurses and midwives in the prevention of FASDs?
I think nurses could have a really profound impact. I think one of the things that nurses are very good at is recognizing strengths. And one of the biggest barriers to FASD prevention is shame and stigma. And so if nurses could really work on how they can work with women who may be pregnant or maybe in the age range where they might become pregnant and work with women in a way that avoids shame and stigma, I think they could really have an impact on open communication. So they could have an important role in screening for alcohol use in a way that's respectful and not stigmatizing. My experience is that for many women, we don't know what their alcohol exposure was during their pregnancy because nobody ever asked them in a way that elicited an honest response that wasn't one that they felt shamed about. So with the fact, I think nurses really have amazing skills in communication and could really start conversations with women that would allow them to share what's really going on in their lives and allow them to maybe be more open to taking advantage of supports and treatment. I also think midwives could have a really important role in pre-pregnancy counseling. I still remember when I was a young woman, I went to my first adult doctor, and I still, I was 22 or something, and I still remember she said to me, okay, I just think, all women who are of your age should really just be on a prenatal vitamin all the time, just because, you never know, you might become pregnant. It's like, okay, so I started taking a prenatal vitamin, and I look back on that now, and I think, what if instead she had said, all women your age should either be on long-acting reversible contraception or should be not drinking alcohol. Like, what a powerful statement that would have been to me before I was even thinking about being pregnant, and would raise my, awareness of like, I have a choice. I have some control over that, and I can prevent an alcohol-exposed pregnancy.
Yeah.
Oh,
go ahead.
Yeah.
Yeah,
and I was just going to add two other things is that I think that, that kind of honest and open communication could really help with reducing exposure in women who may already be pregnant and may have already had some alcohol exposure, because we know that anything women can do to cut back will help their child. And nurses may also be in a position to support young mothers who may have a child who is alcohol exposed, but to get them the supports that they need so that they can be successful in parenting.
Yeah, and I like how you said just a few moments ago that FASDs are 100% preventable. And I feel like that is just so powerful when you kind of tied that back to how powerful it would be if nurses or doctors that we work with do kind of say like, yeah, maybe we should either be on a LARP, is that what we call it?
Yeah.
LARP, or not drink alcohol at all, because it is completely preventable, FASCs. Yeah. Okay. So my last question is, what advice do you have for nurses who would like to become more involved in the diagnosis, treatment, and prevention of FASCs?
So I think the first thing is really just be educated and be aware. There's a lot of amazing resources, kind of like what is happening through this opportunity today, for nurses to learn about FASD. There's amazing websites and advocacy organizations. And I think the more nurses are aware and have some skills and knowledge, the more people will recognize the problem. Kind of like in the world of autism, it's really like awareness and parental advocacy that's made a huge difference in getting kids diagnosis and treatment. If we had a similar level of awareness in healthcare communities about FASD, people would have more access to care as well. I also think people can just contact their local FASD resources and say that they want to learn more and how can they be helpful. Because everybody I know in the FASD world is happy to talk to anybody in their community about FASD, because we know it takes everybody to make a difference in this. And finally, I would just suggest people continue to advocate for legislation to better support this issue. In Alaska, you have a couple amazing legislators, including your late Representative Don Young, who have been big advocates for the FASD Respect Act, which would really provide the type of funding that might be able to help more people with FASD and improve everybody's awareness and knowledge about this challenging problem.
Absolutely. Thank you, Dr. Cole.
Absolutely.
This is very informative, and I feel like is another step towards people getting to learn a little bit more about FASDs. And I like that we kind of touch on that real biological basis of how FASD impacts the brain, all the way to how we can kind of move towards treatment and prevention from all the different levels, including like advocacy as well. So it really does take a whole community and a whole team of different people and different professions kind of working together to prevent FASDs. Yeah.
Absolutely. Well, thanks for the opportunity.
Of course. Thank you. I'm gonna go ahead and stop.